Okay, guys, I'll help you remember. Text start. Okay, guys, in this video, I will help you remember the causes of hypercholesterolemia and the causes of hypertriglyceridemia. So let's first start with the hypercholesterolemia. So increase in the cholesterol level. So you see the picture, you see the three organs: thyroid, so thyro, liver, so hepato, and kidney, the nephro. Remember the three things. So for thyro or thyroid, you have hypothyroidism. For hepato, you have the cholestatic liver disease, And for nephro, you have the nephrotic syndrome. And for drugs, there are some drug causes. You have to remember those one. Androcyclostero, retrodiuro. Andro means androgens, cyclo means cyclosporine, stero means steroid, and retrodiuro means retroviral agents and diuretics. So those are the causes of hypercholesterolemia. So let's rewind. Thyro, hypothyroidism; hepato, cholestatic liver disease; nephro, nephrotic syndrome; androgens; cyclosporine; steroids, retroviral agents, and diuretics. Now comes the easier one, which is the cause of raised triglyceride. So you can remember this: an obese person. Obesity is a risk factor. An obese person has developed diabetes mellitus, and which lead to diabetic nephropathy, which is a common cause of CKD. So the risk factors are obesity, diabetes mellitus, and CKD. And then alcoholic person develops CLD. So the risk factors are alcoholic. So anyone that takes a high amount of alcohol, any cause that causes CLD or liver disease, those are the causes of high triglyceride or TG levels. And then among the drugs, you have the retrostero. So those two are the common ones. Retrostero are also common cause of hypercholesterolemia and also cause of hypertriglyceridemia. And the B is the beta blocker. And among the diseases, the organs that are common, you see the liver is common and the kidney is common. So although the organs are common, the pattern of disease is different. In case of hypercholesterolemia, the kidney is involved in nephrotic syndrome. In hypercholesterolemia, nephrotic syndrome. And in CKD, just plain old CKD causes rise in TG. In liver disease, if the disease is a obstructive liver disease or a cholestatic liver disease, cholestatic, it has the C, chole, so cholesterol, it causes hypercholesterolemia. But if it's just a plain old CLD, just a liver disease, not cholestatic, just hepatic injury, that will rise the TG. And retrosteroid are the common ones, and beta blocker is the special one for rise in the TG level. So that's all.